Nikki. Welcome back. Woo. Welcome back to my trade. Okay, that'll work. It's hot. It's hot in here today. Make sure I can see what the play is. Okay. Woo, y'all. It was cold in here a few minutes ago, but now not so much. Okay, that's a little bit better. All right, y'all. So everybody went to lunch. I came in late, so I'm here. We got a whole bunch of instruments from another facility that is closing. So I'm going to put some stuff together real quick, and then I'm going to work on some case cards from Wednesday. So that's what this video is going to be. I don't know how it's going to flow. Hopefully it flows well, but I'm not sure, so bear with me. I don't know if like people going to come in and all that, but right now nobody's here but me. So hopefully we won't have too many interruptions. But it's hot in here, y'all. Oh my God, it's so hot. So I'm just putting this casket together real quick. This is the casket. This is what we put our instruments in when they get processed and then they go to the autoclave. So I'm putting that's a little filter. I'm gonna put that there. And so yeah, that's all I'm doing right now. I'm not really gonna do a whole lot, but I'm gonna run another load just to have it done. Ooh, it's so hot though. We put these little I don't know what these called actually, but we use them on our caskets. It's backwards. It has a little white indicator thing on it. When it's processed, it turns black. I don't have one in here to show y'all, but this little white thing, I hope you can see it. That little sticker, it turns black. So what it does is it goes in this little slot right here, and it go all the way through. I don't know if y'all can see that, but it went all the way through to the other side. So when I open this, I'll show y'all real quick. When I open it, I pop it, and then this breaks. That's a seal kind of like thing that breaks. So if it's broken, we can't use it. I'm trying to get it off. If it's broken, even if it's sterile, we can't use it. So that's what that is. Ooh, y'all. Your girl got on too many clothes, honey. So this is just one way for us to be able to tell if this tray has not only been processed, but if it's still sterile. Because even if that little, like I was just saying, if that little white dot is black and this is popped, then it's not considered sterile. It's one on both sides, so I'm just doing the other side right now. Okay. I'm gonna put a little thing on the top so people can know what it is. Even though it is already on the tray, well, I'm gonna just reuse because we keep these and put patient stickers on, so if we can track what instrument trays was used on that patient. So I'm gonna just put shadow line. Well, I spelled it wrong. All right, that's that, and then it just gets taped on here. Let's put it to the side. And when I'm ready to run the load, I'll run that. I'll grab that. Right here, I have a lead hand. We use for hand surgery. We don't do hand cases here yet, but if we needed to, we probably could. That's how it goes. You hold the hand in place, and then we just work on Or it might go the other way. Hey, love you too, boo. I've been watching you before. I've been watching you before I started SC school. Now I've been scrubbing for 5 years and currently in RN school. God bless. Well, congratulations on making it through surgical tech school, and best wishes for you in OR. I mean, not OR, but nursing school. But congratulations on both of those. And thank you for watching. I'm coming back. Hold on. Thank you for watching, y'all. I appreciate each and every one of y'all. I really do. Y'all don't even know. I was telling somebody the other day, because I was live for like a really long time. So I was telling them it didn't really feel like I was live. It just kind of felt like I'm just talking to people that I know and that know me or whatever. That's kind of how it feels to me. I don't know. Y'all tell me. Does it feel like something, I don't know, like it's somebody you know? Or is it like, oh, that's just a YouTuber? I don't feel like I'm just like a YouTuber. I just feel like I'm a regular person that record YouTube videos every now and then. But congratulations, though. That's really good for you. Asia? Yeah, Asia. I want to make sure. I was going to call you something else just then. I don't know what I was going to say. I don't know what name I was going to give you. Okay, so this lead hand fit. I thought I was going to get another towel, but I don't. So I'm putting indicator. Thank y'all for the thumbs up. Whoever that is, I appreciate it. Probably was Asia because she's showing me love this morning. So thank you for that. I'm trying to get it in here without needing another towel. Okay, got it. We'll put a little tape on that thing with another indicator. Just like that. So I'm finna wrap this thing. Y'all, let me tell you something. I was watching this lady wrap Christmas presents yesterday, and I was like, oh, she'd be good in the SPD. She could come wrap some instruments. She could come wrap some instruments in SPD for sure. But I was like, let me come help, because we do have an SPD tech now. But I know what it's like for people to not come help you. And ain't nobody else here gonna come back here and help her. So, you know, I will. I'll do it. Hold on, let me try to make that a little bit better. Make sure I am missing it. So y'all was watching the lady wrap the stuff, and I was like, oh my, she's doing a really good job. She's doing a really good job. We need to hire her. No, we don't. We don't need no more SPD people, but you know, when I needed help, it would have been nice. But we got Rakima now. I like Rakima. She reminded me of me. She reminded me of me back in the day when I was a little baby surgical tech. Now I'm a big dog. Even though people don't like it, look, I got haters, right? So when you start getting haters, then you know you can rob. I got haters, and I don't care. I be like, hey haters, to all my haters that's on here, hi. But I don't think I got haters on my YouTube channel. Maybe every now and then it'll be somebody pop in the comments. They'll pop up in the comments and say something. But by the time y'all probably get to them, I be done deleted them. Because I don't be wanting that negative energy. I don't want y'all to get like that negative energy on y'all, because you know, negative energy is contagious. It really is. So I'm gonna just put, what I say, a lead hand. And all right, that's one. Or that's two. So now I got this other tray over here that I need to put together because it is a mess. They sent us a whole bunch of stuff, but when they sent it, they just threw it in the container. So it's just like thrown in here. Stand it when it's messy like this. It's not messy, like bad messy, but it's just not working. Connie James at the door. Okay. Hold on, y'all. I gotta go. on, we gonna go open the door. We got a rep that's bringing us some trays, so he's here. So I might have to put y'all on mute for a second, depending on what he's talking about, but let's go get him first. He must not have my number, because why he didn't call me? Oh, hey, how you got in? Who's here?
There's the...
Hang on, y'all. I'll be right back. Okay. I'm back. Who is that? Oh, he deleted it. Hey, Emmanuel. You took your message back. I hope it wasn't nothing bad. I hope you didn't say nothing bad. Okay. Hold on, y'all. Let me get my shit together. What I'm about to do is we finna go to the other side because he just brought some stuff that need to be in the washer. And it takes 45 minutes for that stuff to wash. So I'm gonna go put that stuff in the washer. I'm gonna take y'all over there with me real quick. We're gonna put that stuff in the washer and then we'll come back over here and put this tray together real quick. Cause it's a mess. So I'm gonna put this right there. Just leave it. Try to keep your workstation clean. Nobody likes to work with a pig, unless you are a pig. Then that's something totally different. What is that? That looks dirty. Okay. I'm gonna just push this out to the side real quick. And then let's go to the other side and put some stuff together. Or not put it together, wash it. Let's do that. I'm just kind of cleaning up a little bit, y'all. Nothing major. Because it be stuff. To me, I just feel like it be just stuff. A lot of stuff. My plan be to keep it. I don't want to throw these away because we got a little spot right here when they the instruments don't be all the way dry. We just use these to kind of soak up some of the water. Let's go watch some instruments. Woo, y'all, I'm sweating. See if Jamie left already. Yep, he's gone. Okay. So, let me put y'all, if I put y'all up here, is that too high? No, I think that'll work. Ooh, don't fall. Okay, we're gonna go with that. That feels too low. Oh, we got all kind of stuff over here. Hold on, y'all. Put you down for a second. All right. Let's see something like that then. Okay. So these need to go in the washer. And then those two. So let's do that. I'm gonna put the whole thing in there. I'm gonna take it out to make sure it don't have no paper in it. But the whole container is going in here. Okay. These are implants. So I'm gonna put this one in here. I'm gonna leave this one. I really want to put this upside down. So let's put that. All of this in here so it don't be, because they bring it in their vehicles and you never know. You know, dogs, people have dogs, I have dogs, people have cats and animals and stuff, and you don't really want, you don't really want that to be in your instrument. So let's take it all out. Okay. Make sure that can swing. She can swing. I could probably get all three of these in here, y'all. That'll be great. Then it's just one load. Make sure these little pegs don't fall out. Oh, they screwed in. Okay. All right, can y'all see that? I hope y'all can see that. I got everything in the washer. I take them out the container because these hold, I mean, they got holes in them, but they might hold a little bit more water when they the other way. So that's why I did it like that. All right, let me wash my hands. Okay, all done. Now we're going back to the other side. Okay, I'm just gonna go over here and do this real quick because I still need to pick cases and work on case cards. Oh, I had y'all up here. All right, I'll put y'all there. Okay. Let's put these instruments. Let's see what we got in here first. All right. Ooh. These look like two of the same. These are cerebellums. I know I'm sorry. Let me bring y'all a little bit closer. I feel like y'all too far away. Alright, that's better. We can take this out. Put it. Sorry for the noise. I know that's loud. I know it's loud. It's like washing dishes, right? It's super loud. So I don't think it has everything that our other tray has, but we could still use it. Yeah, I kind of feel like some people in the surgery centers work harder, work more than other people. I feel like that. I think I might call this an ortho major tray. Maybe. This is like ortho stuff, except for these caryces. It's not all ortho. Okay, let me see. I really feel like that. Like lately, I've been feeling kind of like it's people like they just everybody not pulling their weight on this team. I don't feel like that. I feel like some people are just like doing the bare minimum. That's not even I feel like that. I know that it's not a feel like it's a thing, and I don't know like if it's just me and I'm just kind of over feeling like I'm like doing more. I feel like I do a lot. I feel like I do a whole lot, and I feel like it's some people here that don't do enough. That's how I feel. And they want like recognition, or like maybe I feel like what they're doing is going and you know how some people like brown nose or like ass kiss, like they kissing ass, and I don't do that, and I might come off a little abrasive. So to some people it's like, oh, she got an attitude. Or like I don't really play with people. Like I'm not a game, I'm not a toy, so don't play with me. Like I don't want to be played with. And I like here I feel like it's not hard work. Let me say that. Like what I'm doing is not hard. But I do kind of feel like these days I might be working a little bit more, and my work ethic might be a little different. And so I feel like I'm on a team. I feel like some people on my team are not really team oriented people. Like I work with some people military, like some people here that require military, but even some of them I just be like, oh, we weren't in the same branch, so that might play a role in it. But I don't know how I'm feeling right now. Like I don't know. I ain't feeling it. Y'all. I'm trying to see if these are the same. They the same. So we gonna take one out. We'll put one in. They got this baby weedy in here. I think I'm gonna just keep it in here because we would use something this size. So I'm gonna run down the instruments instead of bitching and complaining about my lazy ass co-workers. We're not gonna even get into that shit, but these are appendices, and you use these to retract. Like if it's a wound, you open that up with these. They're handheld retractors. You got They're called Army Navies, but if you was in the Navy, they're called Navy Armies. So the Navy side is the deep side, and the Army side is the little baby. I'm Navy, so that's what we going with. Right, you dive deep. That's for the deep tissue. So these two, they look like they're the same length, but this will give you more like width and more a toe in. Like this one, both of them toe at the tip, like it's a bend. So they'll still like toe in, but this one is like a more aggressive way to do that. So these both are hand retractors. I don't think we have both of those appendices in our other trays, so we'll just keep them in there. Maybe I'll take them out. I think I'm gonna take them out and I'm gonna peel pack them so we can have them in any, like for any procedure. Because if I put them in one tray, then I won't have access to them. So I'm gonna take those out. This is a long number 3 knife handle, and it's long, and it's in this what they call an ACDF/Lamy tray. So they can get deeper, because a lot of times with Lamys and ACDFs or neurospine, you're working in a hole, so you need to be able to get down. I'm gonna leave that in there. And then, so these are kerosene. This is a kerosene, and it's used to bite at tissue and bone. You can like, well, really bone. So you can like gnaw at it, and then like they pull it. And when you use these, if somebody grabs a set of these, or if they want to use this, then I automatically grab a lap sponge, and I use the a moist lap to clean off the bioburden after a bite. So let's just say the dog, they'll bite the bone and they'll come out, and then when they come out, you wipe it off. And then every time they come out, I wipe it off, even if they say they're not asking me to. And then sometimes when to pass them, the doc will have their hand out like this, because this little part is a thumb rest, so it sits like this. But sometimes they want it upside down, and their hand will be backwards. So you kind of like just do like put it in their hand like this. So then it's still on the thumb, this part, but it's in the thumb when it's upside down, and they're using it like that. I had to learn this hand gesture, like, I don't know how to explain it. When they was doing it, I was like, what is that? Like, what are you, because you know, in the OR, we read sign language. Like, it's not sign language like the kind where, for deaf people, not that sign language, but there is the OR sign language. And a lot of times, this could mean a whole bunch of different things, right? Them just having a hand out, or even me. If I'm assistant, I might just have my hand out. If you're not paying attention, you're not gonna know what I want. But if you're paying attention, you're gonna know it's gonna probably be a kerosene dependent in this procedure, like an ACDF or something. It's probably gonna be a kerosene. It's hardly ever like a scissor, except for at the beginning of the case when they're dissected down to the disc. Okay, so another instrument that we use a lot in like neurospine cases, or even I already knew what this was before neurospine, but we use it too, and it's a pituitary rongeur, and then this is a micro pituitary is what they would call it, because it's a little baby, so y'all can see the difference. And they're kind of a little bit sharp, and then this is also used to bite at tissue, not bone. This is not hard enough to break through bone, but it can bite at like muscle and tendons and ligaments. It might not get a whole ligament, but it might be able to get a little bit, because it's a little sharp. The little mouthpiece is just a little bit sharp. So this is suction, and this is the first. This is still wet. It came out the washer. So that autoclave is done. That's what y'all just heard. So I'm just opening the door. I'm gonna let it sit, because you can't take it out. It's gonna make it sweat if I take it out too fast. And sweat, water in general is, sorry y'all, I know it messes up the live, but I had to answer because that was Rakima, which is the other person who worked with me. So So anyways, this is the Fraser tip suction. This is a number 10. I would like to have a 10, a 12, and an 8. But I don't see, actually, I'm going to take out this number 3 knife handle because I see they got a number 7. I'm going to put the number 7 knife handle in because that's what the other tray has. Pill pack that one. So it's available if we do need it. But I do want 2 more suctions. I want a number 8 and a number 12. So I'm going to see in a minute if we got those pill pack, and I'm going to put it in this tray. They also put some Cinerates in here. I don't think I have Cinerates in my other one, so I'm not going to put it in here. So we got a sharp one, which y'all can see the teeth on that one, and then this was blunt. See how that one is like no teeth or no pointies? A lot of people like this one because when you holding this one, if they want you to use this side, which is kind of like a rag nail, doing hand cases, like the one like if we was to start doing hand cases, I would actually use this side. So let's just say we're doing a carpal tunnel. Sometimes they'll use this in a carpal tunnel to pull the ligaments and the tendons back and to be able to see. So you don't really want to use a sharp one because the chances of you getting stuck is greater than it is with a dull one, right? So if you're gonna be doing like hand cases and stuff, they might want a sharp one because this will hold back like skin or whatever like that. But don't put these up if you don't have to. I'm gonna take them out of our tray. I'm gonna peel pack those. All right, so we got some pickup. They got 2 of the same. I'm gonna take one out. Both of these are Adson with teeth. You see the teeth on them? They're the same. I'm gonna take one out, leave one. We also use, we'll call them the bakies. Well, these are the bakies. So we got a long pair, we got the bakies. These could be just smooth pickups. I'm gonna call them the bakies. So we got a long pair and a short pair. That's what I'm gonna call them. This is a Penfield 4. I learned this one. It reminds me of a Freer. Let me see if I got a Freer. I don't think a Freer is in here. I don't see a Freer. I don't see a Freer. So I think I need a Freer in here, but I have to look and see if this one. They got this other thing. I don't know what this is called, y'all. A spatula. I don't know. I'm gonna leave it in here because it kind of reminds me of a Freer, but it's not a Freer. It's angled on both ends, and a Freer is not angled. A Freer looks just like this, except for on both ends. One's smoother. I mean, one's more narrow. This a Woodson. This is a Woodson. Somebody just asked me for one of these. We got another one. It's got a black handle. Thank you. Is that Tanisha? Did I say it right? Is it Tanisha? Thank you. I didn't know what this was. Somebody just asked me for one of these not too long ago. I guess I'm gonna leave it in there because I think I put one in the other tray. But a Freer is more narrow on one end than it is on the other one, but both ends look the same. This is a Penfield 3. This, I think, is a this is a Penfield 4. I'm sorry. This is, I think, a Penfield 3 because it's got the cup on the bottom. I think that's right. So we're gonna put these in here too. Then we got a nerve retractor or a nerve root retractor. That's what, yeah, a nerve retractor. I'm talking about root retractor. A nerve retractor. That's what this is. And then for our forceps, we always have to have, in this tray, you always need a bell netted pair, of forceps because we work down tubes sometimes. This one's really long, but I'm gonna keep it. It's long and it's kind of, I don't know, y'all. It don't seem as sturdy. And with these, I had to learn this too because I'm not used to this type of procedure. It's like this, knees up. So it's used like this. And then this part back here is to stabilize. So it's used like this. They remind me of chopsticks. That's what they look like to me. These and the bakies. So we will keep those. I don't like these. Just feel like these are just they're long and flimsy, but we're gonna put them in here and we'll see what they say. If the docs complain, I'll take it out, but they just seem a little flimsy. I feel like I need to replace them anyways. I might. Let me see if I can find some. So we got these, and then we got these bipolar, knees up, right when you pass it, knees up. And then these get connected to our bipolar cord. And these are a little pointy and they're short, but we're gonna leave them in the tray. I'm gonna put them off to the side for right now, just so I can go look in the peel packs to see if we have anything to replace them with. If I can replace these, I'm going to. I don't like either one of those. We're gonna put those right here. So now we got all of that situated. Now we got all of these little ring instruments. So I'm gonna show you what, oh, here go. This is a Penfield 1. The cup is more angled and it don't have, I'll show you the other Penfield. I think this, what I said, this was a Penfield 3. This one has little pointies on the end, right? Y'all see that? And it's like that. This Penfield 1 is way more angled and it's nothing on the inside. But they both have these like little spatula looking things on the other side. We're gonna leave both of those in there. And then we have another, what did he call this? I want to say it's also a hook, a nerve hook is what this is. We're gonna put this one in here too because they definitely will use this. Now, for these ringed instruments, they don't have a ring that they came with. So what I'm going to do, I'll make a ring, like a stringer. Oh look, I found another suction. What is this one? This is also a 10. So this came with 2 10s. Let me see. I'm gonna take this one out. I'm gonna put this one back. All right, so let's look at these instruments real quick. Oh, I'm uncomfortable. These are peons. You can see the tip of them, right? Those are peons. We use these with Kittners or peanuts, right? Now, they typically don't use Kittners or peanuts for bleeding control. From what I see, they're using them for dissection. So instead of me like if I had a Kittner, y'all know how they look, right? I'm gonna just pretend like this is a Kittner. I'm gonna just roll up something. So with a Kittner, I would typically kind of load it like that, where it's a little, you know, more of the sponge on the tip. But since they use it for dissection, I choke up on it a little bit more. Like, I don't really, because they kind of just using it like to push some tissue back versus to suck up blood or fluid, right? So that's how they're using it in neurospine. That's what I've been learning. So we're gonna keep these in the tray. We got 2 of them, and you always want to have one loaded, right? And sometimes you can flip your peanut. So if it's not like saturated in blood, you can flip the peanut upside down and use the other side. But if it gets too saturated, then you can't really use it for the dissection because it's too wet. So we're gonna keep those though, right? We got some meds. Y'all know what these are. These are tissue scissors. Don't use them for suture because they will make them dull. We got a short pair too. We got another pair. We got a little baby pair. I'm gonna put those in here. I'm putting them in the front. We got suture scissors or straight male tissue scissors is what they will call them on your test if you have to take a test. But in the OR, these are suture scissors, okay? I'm gonna put them with the scissors. Then we got some curved male tissue scissors, and we use these to cut tissue with most of the time. We cut our suture with the straight ones, and you don't really want to use your suture scissors on the tissue because the suture is tougher than tissue and it'll dull out. The tissue scissors would dull out before, the suture scissors would dull out before the tissue scissors. So if you're gonna cut tissue, give them the curved ones because you shouldn't really be cutting anything but tissue with the curved ones. And I'll put them together so you can kind of see the difference. So curved, straight, right? Suture, tissue. Okay, if you work in labor and delivery, you'll use these. They cut and fascia with it. We ain't cutting a whole bunch of tissue in here. We have some Alice tissue. What are they? Forceps clamp? Alice tissue clamp. I think it's a clamp because it has a lock box on it. This is for, it grabs tissue, not fat. You can use it on muscle, but you don't want to really use this something so aggressive on muscle, but you can. But these will be used like for like some tough like tendons and that kind of stuff. Something with some like toughness to it. We have 2 of those. And then we have, let me put you back. Wait a minute. I think I lied to y'all. I think these are tonsil clamps. These are tonsils. I'm gonna say these are schnit tonsil clamps. That's what I'm gonna call these. I think they are, because this looks like a peon to me. Can y'all see the difference? This is more beefy and this one is more like fine at the tip. These are peons. These would be considered schnit or tonsil clamps. That's what we're gonna, that's right. So, but those, don't come for me in the comments and be like, them is schnits. I got it. We're good. Stay calm. But I don't have one of these. So because I don't have one of these, I would still use my schnit. I could still use my schnit tonsil clamps as for my peanuts. But we got one of these. I'm gonna leave it in here. And some people call these Kellys. I done been to places where they call these Kellys. So they could be Kellys. They might call them Kellys. If y'all don't learn nothing else in the OR, what you're gonna learn is that some places they call things one thing, and then you're gonna go somewhere else and they're gonna tell you it's called something completely different, and then they're gonna expect you to remember that. Cause how? All these names, y'all just change the name. We had an instrument called Playboy at one place. Like they be naming stuff, all kind of stuff. These look like they trying to use them as hemostats, but these are cokers. That's a coker. It's very aggressive. You do not use this on delicate tissue. You use this on something that has a like tough, like a little more tough tendon, ligaments, and some of the fascia. I don't know where to put that at. I think they trying to use, so these both look like baby cokers instead of straight hemostats. I think that's what they try to do. I don't know if I want to keep them in here or see if I got some hemostats. These are 3 of the same thing. But I think they're trying to use these as hemostats, and they're not. And I don't think we have any more hemostats, but I'm not really happy with this tray, so I don't know if I'm going to put it up yet. We got a right angle. What I'm used to using right angles for is to pass ties. So let's just say you got the tie for vessel, right? What'll happen is, or they can be used for dissection too. So I've seen doctors use these or surgeons use these to dissect down, and then they'll get to a point where they have where they're trying to get to, and then they'll flip it, right? And now the points are up, and then you'll grab a piece of a suture, and you'll hold it and you'll pull it through, right? And then they'll tie it off or cut it or use a retract. Sometimes they'll put a traction suture in, a traction tie in, and just hold it. But this to me is like a passing instrument. I really don't know what it's in this tray for, but I mean, I guess this tray is not complete. We won't be using this until I can figure out if we got some more stuff to fix it. These are needle drivers. It's 2 of them, so we will keep these in the tray. Yeah, I don't think I want to put this tray up just quite yet. But honestly, for the narrow spine stuff, we really don't use a whole lot of like instruments, like these kind of instruments. It's not a lot that we'll use. We'll definitely use the suture scissors and the Mayos. the mets, I'm sorry. We'll definitely use the suture scissors and the mets and bombs. I clamp a whole bunch of stuff because I'll have to clamp a drape. But I don't want to clamp no drape with no cokers because what they gonna do? Put a hole through it, right? I could use these Alice clamps in the right angles, I guess, but I'm gonna see what else I have in there that I could replace these or make a full set with, because I'm not happy with this set. Like, I wouldn't feel like I'm good. I don't feel good. I don't feel good. So if you don't have a ring, y'all know what the thing is called, like and make sure my hair stay covered. Y'all know what those, I don't know what those things are called, but anyways, where you a stringer. We don't have any extra stringers, and that's just fine because we have these two traumatic. I just had a complete traumatic towel clamps, cryos. That's what you're talking about. This right here is this one that's called a Kelly. Hold on. That's what you're talking about is a cryo. Tanisha, I think this is what she calling a cryo. I think I'd have heard these called Kellys before. I'd have heard cryo. I feel like I was trained on these. Maybe it was a little bit longer. I feel like a peon looked like this, but a little bit longer. I know these are schnit. These are tonsil clamps, right? This is a schnit tonsil clamp. A schnit. Yeah, I feel like they call these Kellys as well. But when I look at this, I see a peon. What you miss it? Or a Crims clamp. Crowd. Okay, that's what this is, y'all. So that's what that's gonna be. But I'm still not really comfortable with this set. So I feel like I need to go and look for some more stuff to see if I can make it to where I'm comfortable with using it, because I'm gonna be the one using it. So I'm not gonna set myself up for failure. I'm gonna set myself up for success. So before I put this or sterilize this, I'm gonna go check some more instruments and see if I have some more instruments to make this a complete set. But what I was trying to tell y'all, that's a peon. So is a peon and a cryo the same thing? Tell me that. What you think? Yeah? I'm gonna put it next to the that's a peon. Is a peon and a cryo the same? What you think? No? Is a cryo shorter than a peon? I need to get my book out, don't I, y'all? It's the instrument book over there. No. You said no, they're not the same. They look the same. I think one is longer than the other one. Yes, one is longer than the other one. So a cryo is also a Kelly. Yes. She should say yes to that. I think that's the she. Is it Taisha? Taisha. Yeah, Taisha. I'm saying it right. I know I'm saying your name right. So we don't have a stringer, so I'm gonna make these traumatic, because this is gonna cause a whole bunch of trauma if you grab it with something. Towel clamps. I do not use these on my drapes, but if you towel off like a 4-square towel off, you can use these to towel off your drapes. That's what I was taught to use them for. But I don't use these on my towels anymore. I just use sometimes I use staples if we have them, but I feel like a lot of times I don't even need them. I just put some places mix it in with cryos and Kelly clamps. See, it's just confusing. It just get confusing after a while. But we gonna just leave it in there. So look, if you don't have a stringer, hey girl, hey. You were gonna be loud. I told you it was gonna hear me. If you don't have a stringer, you can use the towel clamps as your stringer. I'm not gonna put this up right now. What's up?
When those get to pull the cases.
Okay, y'all, everybody back now. I'm finna put these up. I'm gonna put them in the tray. So I don't like this tray yet, so I'm not gonna put it up. I'm gonna see if there's some more stuff. It's missing some stuff. So I'm finna go see if I can find some of these pill packs, and I need another. I need 2 more suctions, so I'm gonna go look for those. And then all of this stuff right here, I'm gonna just put it. I'm gonna pill pack all of this. And then I think that's gonna be it for in here for right now until that comes. But I'm gonna leave this in here because it looks like you need another tray. I mean another back table.
And then I'm also being mindful of the indicators I got left.
Ain't no more?
That's bad.
Look, I wanted to get another bag of this stuff big. Yeah, ain't no more. This was over. She was like, oh, unless you wanted that. Alright. Let's put up my mess. So I'm gonna just peel pack this stuff. This one I'm gonna put in another, I think, maybe I'll peel pack it for now. What you want to do with this one? You want me to leave this out for the other, remember how we was looking at the other one?
The matrix.
Okay. This one had 2 of the same ones.
Okay, so I can put one in.
Or you want to peel pack it?
I might get this.
Do you leave it out? I'll just leave it right there.
I might get that change now.
I'm peel packing all of this. Just so at least we'll have it. Oh, but if I'm not gonna peel pack it then if you were our indicators.
I mean, you can feel like it for later.
Yeah. Okay. Cause if this all of them. Yeah. I know ain't nowhere else in here because I took everything out the drawers. I might put one of those in there. Okay, this need to go. I want to check tomorrow when I use the ACGM tray. Okay, look, perfect turbo. It's at the nursing station now. Okay. Take it. I was gonna work on the preference card, y'all, but I'ma just make my own notes.
For tomorrow.
Yeah, I'ma just make my own notes. That's me. Who helped me? Oh, you talking about Sam? Yeah, I guess. All right, I won't be like that. Well, okay, fine. Feel like I should just keep my intellectual property to myself. Do they pay me for this? I don't know. Maybe they do. I don't know. I don't know if they're paying me for mine. No, because I couldn't go in, but she picked what she thought she was supposed to pick. That's what she was say. Is it like you don't have to read? A little bit. I gotta go take stuff and add stuff, but that's why I was just like, okay. But what she did, she put it like for what she did is what we did for Dr. Rivera, because he got like easy cases, so it's like you don't have to add nothing to it. Like that, the other guy stuff, I gotta add some stuff. So I'm gonna just put these right here because I need to see what's going on with it. Some places, okay. Well, Rakima told me to be good, so I'm gonna be good. I was feeling petty a little bit just then, I ain't gonna even lie. Alright. So I just put them all in pill pack so you'll know like what you're doing. Yeah, but I ain't put no educators in them and they probably gonna need another what's the word? Pill pack to go in another pill pack. And this is huh? That's it, yeah. It's 3. Is it 4 to go in? It's just 3. I don't remember how they put it in there, but one was back up. Oh, one is like our shadow line. That one we need That one is like the one that you did yesterday. And then he said that's a backup. So you can keep this you can keep this back table if you need it. You want to keep it in here? Okay, I'm gonna just put this up here real quick. It's not ready yet. That's definitely not ready yet. I still need to I need to check to see if we got certain instruments. Them two, I kind of want to put in another the AC, the major, both of them, because I don't think we have that size cerebellum in the not that size. I'm sorry, that angle, because he wanted it he wanted an angle. So I'm gonna work on the preference part. You good for now? Or you gonna run some more stuff? But that pretty size that. You just want to work on that, and then the rest of it can just get done whenever. Huh? And then the rest of it can just get done.
Yeah, whenever. Like I said, kind of. And then what the name is when I do it? Do I just.
What these right here? This can just be named, yeah, that's right. Correct. These are not hand trays. These are biters. This is our grocery stuff. I don't know why these didn't say that. I mean, they go in a tube, like, oh, it's on the other side. So these right here go inside of a shoulder or a tube, if they use a tube for the shoulder. An obturator, I think that's what it's called, or a porter. But these are not hand instruments. That's wrong. Don't label that. That's gonna be like, what? That is not what we need. Okay. So yeah, and this one all the same. And then what's this one? So this one and that is what the same thing. Yeah, that's. But this one don't have the camera thing. I think we gotta
One of them got a shaper. How do you say that?
Oh, any?
Well, yeah, one got the camera like for
And the shaper. So what we might be able to do, you know how we got our grocery trays? We could probably put them in, like, all in the tray. Not now, but, because we got stuff that's got a camera and light cord already, and a scope already in the tray.
Yeah.
We really could put, but that one's still missing stuff.
That's 3.
Oh,
Then the one back there.
we could just wrap it. I'm gonna go back in and work on these preference cards. All right, if you need me, just, huh? I wrapped the hand. I put some stuff in pill pads. And then the only other thing I did was open it, but it's probably, if we need it, it's gonna be for Wednesday. I don't know if we got another decompression, but if we do, that's for Wednesday. But if you need me, I'll be, you gonna sit in front of the sterilizer? You still cold? All right, I'll be at the nurse's station. All right, y'all, we finna go. I actually need to pick or check these cases that Sam picked real quick, because this doc have other stuff that need to be added to his cases. So we'll fix that. It won't take too much time because he only have 2 cases tomorrow, and they're both ACDFs. So let's go get some stuff. She got the bin down here, so we'll just take the whole thing. And then I'll make a case. I need to make a case card for the ones we did yesterday, so because that's what's fresh in my head. And I'll just do it. And I took a picture of this stuff. It's empty. It's empty. So I am gonna make a case card for Dr. Graham. Well, we have one, but he requires a little more stuff than Dr. Graham. Yeah, I am. But I am live, so just. No, you're fine. You don't have to leave. I was just gonna come, so we don't have to put, did you put this one in here?
Yeah, because of the things that were breaking last time.
Okay,
It was just in case.
okay, so we won't open it. I was gonna say it's one that's already in there.
Right.
Okay.
But I thought about them breaking the other day.
I can't remember. We'll put that right there. So, we'll put some, so all of them get, I'll wait for you to finish doing that. I'm gonna push this back. All of them get, all of his cases don't get a C armor drape.
Okay.
I will make a list for you so you don't have to remember it. They'll all get a C armor drape. Gonna probably add a back table cover to both of them. Well, I can't remember if I needed a whole table at that time, but I'm gonna put it in there anyways.
And the 10 drape thing.
They're in the other one.
Yeah, I think I have some
In the room.
In the room.
They might do better the other way, the long way, like not stacked on top of each other.
Like standing up.
Yeah, like this.
Like this, standing up.
Let me see. I can't see what you're pointing at. Yeah, like that. You might be able to get more in.
Ooh, this is tight waters.
It is. Yeah. What you think? Maybe the same.
You boss.
If I was the boss, we would get paid more and probably work less.
I'm gonna vote for you.
You don't want me to be the boss. I'm like, this is too much work. No need no more. Too much work, too many. Nah, it's not that bad. Yeah.
Is there any more out there?
Mm-mm.
So we got 8 in there.
Okay. All right, so they all will get boba tips because the boba tips that come.
They like the insulated.
Yeah.
They used to have a bunch of them in the room. I told
I might have
Tom.
to order some more.
That's what I told
Because we have some.
Kristen. I said we need to order some more of these.
So I'm gonna do these, and I'm gonna give him extended. I think I'm gonna hold it. I'm gonna take them in there, but I don't think I gave them to him the last time because I kept asking him if he wanted them, and he kept saying no. And then I'm gonna put these 1x1s in here. The these. And what else he get from out here? I think surgical.
There's 3.
In the room, I know I put 2. I didn't know where you wanted me to put them. That's why I just
You're
left
fine.
them there. I just put them in the cabinet.
That's fine.
I'm gonna put these in there because these get stirred. And I'm done in here.
So is this the case that he's gonna want like the AP drains?
He didn't ask for one. I don't think so on the throat.
Okay, I'm just trying to figure out which one he was wanting it for. I thought I don't know.
I don't think so on the
I got the restraints too.
I don't think so on the AC on the anterior. So because they don't have yank irons, we're gonna put some yank irons in here. You already put the stapler. He won't use the staplers on the anterior either. He'll use them on the lumbar.
Be able to put
What? Oh, I need distraction pins. I'll get those too. They down there. And then I think for the suture, put you guys right there.
Are you live?
I am live. Please don't fall. So bone wax on every case. I think where your phone at? It's in your pocket. It's not okay.
It's not here.
I can't remember. I think I gave him these the last time, the 2-0 pop-offs for each case. Yeah, that's a big needle. Well, I gave you CT too, right? Yeah. Okay. We'll start with that. I think this one empty. I'll order another one of these. I'll put that right up for now. 2 yank hours, and they're on the other row. They're right there. And what else? If you want to grab those, you want these to take them out of here? The chloroprep?
Yeah.
Oh, he gonna need, did you put 4x4? So, because remember okay, so that's,
I
do
did.
you need 2 of these then?
Well, we're gonna need one for each.
He said 2, didn't he make you do it twice?
Well, that was because I prepped for
Oh, okay.
a position in March.
And then these is the
Okay.
10.
I don't need the snap covers.
Nah, I just put 2 of them in there.
Okay. I only have one yank hour.
You need 2 of them.
I got some in
No,
the.
they're in there.
Oh,
But
I'm
they're
not-
all the same.
They fell out. Okay.
Well,
my
they
bad.
just look different.
No, there was some in here, and I see they fell out.
Okay, and he like that Metaport, that his
The Metaport, this?
yeah.
Metaport
Is that
bag?
empty?
No,
We just need to go up here.
and we don't have.
Cause see, it's a whole bunch of them.
Does he want
We gonna put that on.
Dermabond? Or is he gonna
did I
suture and
use-
then?
Oh no, we gon' oh, is this all the Dermabond?
I don't even. Is that Dermabond?
Yeah.
I haven't seen one like that.
Do you have some in your room? Probably not. I think I took them
Because I
all.
had the little ones, and that was.
I think I took them all. So they, even if they want Dermabond, they can't have it because I don't have it. We ordered it. I know we did.
Okay.
I need to look at my thing and see what the suture is, but
Want me to go grab my phone?
I'll look. I'll just look in a minute. I'm not worried. It's nobody in there right now. It'll just be on the well, it don't look like it's somebody in there, but it'll be on the back. When I get done, I'll just look at it. I think that's it. I feel like I gave him a monocryl. I'll just look at it, and whatever else we missing, I'll just add it. And then I'll just make a preference card.
Yeah, Kristen came up here asking about the preference card.
She's doing charges. She's not making our preference card.
No, she asked me if you had the book, and I
Yeah,
said,
she took
yeah, I
it.
think so.
Yeah,
Oh,
she
okay.
took it, but she's not making preference cards. She's making charge
Right, I
sheets,
did that this
which you can in the future use the charge sheet for the preference cards.
Mhm.
But I'm making the preference cards because our preference cards will have the instruments
Position,
and everything.
right,
Yeah,
and
the
I
local and all of that stuff
I
on there.
totally agree.
So that's what I mean. They could. I think she does have a spot on hers, but because she don't work back here, she don't know what we do. So
We do what we do.
yeah. All right, that's it for now.
All right, I'm gonna push this back over.
I'm gonna go make some. Sit down. I'm gonna do Dr. Rivera's first because that's what's in my head, and then I got notes for Dr.
Oh, you
Graham.
said my preference card?
Yeah, I already got. We got some for Dr. Graham too, but I got Dr. Rivera in my head right
Yeah,
now.
Dr. Graham just had that one page that kind of worked for the ACDF and the,
I
whatchamacallit.
thought somebody was in there.
You thought somebody was in here?
Yeah, I did.
You want this long table over on this side?
I don't know what side we're doing
Okay.
to know where to put it right now, but
Anything else you need to pull?
I think we're good for now.
Take that thing back. And it's okay to leave that door open.
All right, so let's get this out the way because that's in my way. I'm gonna put you back. So now, y'all, I am working on preference cards. So I'm gonna just write down. I'm finna do a data dump. Is what's finna happen. I should have did it yesterday, but I didn't. Okay. So what did we do? We did a permanent. I spelled that wrong. Pain pump. So this one, the patient, he was prone, but positioning could be anything because we've done a pain pump. Most of them, the pain pumps are on the patient is prone, and we putting it in the back, the pump and the electrodes and the pump. But sometimes we do lateral where we're doing the leads in the back, and then we put in the pain pump in the abdomen. I don't know what like determines the difference, but I'm gonna put very for the positioning. So, cause that's unknown. But what we used was we used a spine pack, lesser, I'm gonna do like that, lesser spine. We used, I need to put another knife blade in them other ones because we used 2 knife blades. Anyway, so Dr. Rivera, let me see what he get. So we'll do a Bobby tip, a yank hour. Because they don't put a yank hour in our pack, and then the Bobby tip that they use, but they don't come with insulated Bobby tips. So we use insulated Bobby tips. And then what else did he need? He needed 1% Lido with Epi, and then he used Vanco. I don't know how to spell that, Vanc. Powder. I think we used 20 cc's. We used 20 of the local with him. And then what else did I do, y'all? I'm trying to remember. Oh, he need a C armor drape. I'm finna just get everybody C armors at this point. A C armor drape. That's really all I think. And then for instrumentation, minor tray. Okay, so I'm gonna talk through the procedure. So he's gonna inject two sites, because he has the site where we're gonna put the pain pump, and then we have a site where we put the leads at. So I got the 1%, and then he'll use a 15 blade for his incision, which comes in the pack. And then, so that's that. Then he'll dissect down with his finger. Once he gets to his, where he wants to be at. Who is that? Hey, Connie.
Good question.
Hold on. Let me just mute this. I was finna end my live, but she said never mind. So back to this. I'm gonna walk myself through this procedure just so I know. So the last thing I said, I think he dissects down with his finger until he gets to his spot. And then what do we do? Oh, we get it's a whole kit that comes from the reps. So we get their needle and then he tunnels down. So we definitely need the C armor for that because he'll tunnel with the spinal needle, to hit where he needs to be at. So he has to do that on the X-ray, and then to make sure he's in the right spot, he'll go lateral, and then he'll do an AP, and then he'll go like lateral. So he'll do that, and then we'll put the leads in. Yeah. Oh, and then the suture. So we'll use let's write suture. 2O at the bond. At the bond, I spelled that wrong. Bond pop-offs. I think it's on the CT. Let's see. Capital T2. I think that's on the CT2 pop-offs. And then he'll use a stapler on the on the skin. He'll use a stapler. And he used the bank right there. So drapes and pads, and then supplies. Okay. Instruments, suture. Okay, that's him. And then I'll do a SI joint one because we also did that. I'll use the back of this because it's the same doctor. SI fusion. And then for that one, he'll use the same pack. Spine. He'll need supplies. He'll use what supplies he'll use? He'll use, I'm trying to think what we do. Same thing, local. We'll use local 1% with that B. He'll probably use 10 of that, and then he'll inject, he'll cut 15 blade, that's in the pack. He'll dissect down again with his finger, and then we'll use the stuff out of the tray. We're using T-Fix fusion system. Okay. So what else? I think that's it, really. So what I say, I need an insulated bobby tip. Insulated bobby tip, a yank hour. I need a C armor. I need local. He gets 8 times 2 for his gloves. All right. Suture. I think I give him 2O Vicryl on the CT2 and stapler. I think that's it. What time is it? That's an hour and a half. Okay. I might be missing something, but I'll check it on my phone. Oh, instruments are a minor tray and T-Fix. What time is it? 2 o'clock. T-Fix what are we calling that? T-Fix fusion tray and implants, because we keep that one here. All right, I think that's it. I still have to work on another doctor's, but all of his stuff is in my phone, so I need to look at that. Okay, I think I'm done with him. I'm gonna work on this other one. Oh, maybe let me just see. It might pause, y'all. Hold on, let me just see. Who's texting me? Hold on, let me just look since nobody in here with me anyway. So right, but one of them we did was ACDF and one was lumbar. So one is lumbar. Let me do that, and then this is ACDF. He does not use local on his ACDFs. Monocryl, Dermabond. We have one. We might be good without one. Pax, Spine, Bovie, Tips. I'm gonna put Tips in there. I'm gonna put a long one just in case. Yank hour. Well, he won't use a yank. He'll use, so we don't need a suction temp for those because he uses Fraser tubes. So Fraser tubes, what else I need? C Armor, did I put that on here? C Armor. I think he aids 2 times 2. And then his PA, I think is, yeah, that's his name. 7.5, 8. I need to put them distracted pants in there. All right. I need to see if they're men or women too, because I think the men get 14. No, somebody get 14, somebody get 12. Oh, it's 222 on the clock. No, this is not me. All right, so we have 2 of the same cases tomorrow, so. And then instrumentation, let me put instruments. I'm gonna rewrite this. Instruments, major. I'm gonna just put major trays for both of these. Because we don't have any other, we don't do any other procedures right now so at some point I'm gonna have to go in and call them neuro major and neuro major. And or ortho something if we end up doing ortho cases. Suture, I think I put O, that's up there. I wonder what did he close? I think he did O. Vicryl pop-offs for, I think he did pop-offs for his ACDF. I think he did O Vicryls. He might have did 2 O Vicryls too. I need to look. I'm gonna put it all up, and what he don't use, I'll just take off. I think he did O Vicryls, 2 O Vicryl, 3 O Monocryl, Dermabond, 4x4s, and a Tegaderm. I think that's what we use. Come on. All right. Let me see if the 2 people for tomorrow are, so, okay. All right. I'm gonna just put both cast bar or distraction pins. I use that word or those interchangeably. I'm gonna put both of them in there. And then, so I say instruments, and then what is his retractor set gonna be? He's gonna use, I think, it'll be shadow line cervical. Oh, and we got cervical Kerrison's too, cervical. I think for this one he used shadow line, and I'm gonna do cervical, and what was those hooks? I have to find out where we got those hooks from. I think they were black diamond. I don't know, hooks. I'm gonna have to figure that out. That's for lumbar though. But for tomorrow, I think we good. And then, so rep brings implant systems. Okay. I think that's it, y'all. How much time was it? An hour and a half? I feel pretty good about this. Yeah. All right, so I think I'm gonna go ahead and wrap this video up because I done got hungry. But so I did everything I said I was gonna do. I sterilized some instruments today, even though we didn't have no patients, but people be like, oh, well, what you do when you have no instruments? When you have no cases. So I process instruments, we put up supplies when we have supplies. Right now, as you can see, I'm creating preference cards, and I'm just gonna check it over to make sure I got everything I need, and I'm gonna go grab me something to eat. I might wait, cause I ain't really like hungry, but I might grab something. So, I might grab something cause I might not want to cook tonight. So, anyways, I think that's all I got for this video, y'all. If you have any questions about anything you see on here, feel free to leave me a comment in the comment section. Yeah, and I'll catch y'all on the next video. Bye, guys.